Okay. So hello friends, welcome back to my channel Medicine of 101. Today we'll talk about fast heart sound and the clinical correlations with this one. Okay. So before starting the topic, let me tell you that I have already uploaded a video based on the cardiac cycles where I have just little described about the different types of the heart sounds. Okay. Now basically, if I start the topic over here, that the fast heart sound. Now see, I'll just draw these parts, that means the different types of the chambers. For example, the right atrium over here, the right ventricle, and the left atrium and the left ventricle in a box pattern. Okay, let me show you. For example, I'm just taking in this way. Now see, okay, for example, it is the right atrium, the right ventricle, is the left atrium, and it is the left ventricle. Okay. Now see, what we know during the atrial systole. During the atrial systole, we know that the blood that will come from where. Okay, so if you write it over here, that during atrial systole, the blood that will come from the atrium to the ventricle. In the same way, we'll see over here. Okay, the first things we'll see over here during the atrial systole, we'll get this type of thing. Now, whenever we know that whenever the blood that will come over here, that means within the ventricles. Now, whenever the blood that will start coming within the ventricles, we'll see that within the ventricles the pressure. Within the ventricles, the pressure that will keep on rising in the same way. Now we'll see in the next phase that whenever the pressure within the ventricle that will be greater than the pressure within the atrium, so there is a chance of the blood to backflow from the ventricles to the atrium. As a result, we will see there will be closure of. Okay, let me show over here. There will be closure of the both valves, like I mean in terms of the bicuspid valve, in terms of the tricuspid valve over here. Now for these things, let me show over here. So for examples, we'll get the closure of the valve. So whenever we are just getting the closure of the valve in terms of the M1 T1 over here. So let me show over here the mitral valve and the tricuspid valve. During the closure, we'll get the what? Fast heart sound. We'll get the fast heart sound. Okay, and whatever the after whenever we are getting the fast heart sound, after that whatever the sound we will get, most of the students they can say the second heart sound, but it's not true as far as the internal medicine is concerned. In terms of the physiology, you can say over there. Okay, now see, after ASM whatever the thing we will get. Now I have already said you over here. For example, over here is the in terms of the pulmonary valve, and in terms of this the aortic valve. Now as we know that is the it's the right atrium is the right ventricle, is the left atrium is the left ventricle. Okay, now the pressure that will keep on rising over here. Now whenever the pressure will be greater than the pulmonary pressure over here, so as a result we will see that there will be closure of this valve. Now whenever we will see the closure of this valve, the same way, whenever the pressure within the aorta, within the left ventricle that will be greater than the aortic pressure, here we will also see the opening of the valve. Now before opening the valve, we will see certain time during the closure times. For example, over here, there will be no exchange of the blood in between the atrium and the ventricles. There will be no exchange of the blood from the ventricles to the outside. Okay, in this time it will act as what? It will act as isopolymetric chamber. Now where we will see in this times there will be systole of the ventricles in this time. So you can consider these things as a result of what? Isovolumetric contractions. Okay, now after that whatever the thing we'll see, let me show over here. Okay, now see, this valve is still closed, tricuspid valve, bicuspid valve is still closed. Now we will see over here, whenever the pressure that will be greater than the ventricles in the both cases. Now here we will see that the blood from the ventricles that will come out. That means we will see ejections of the blood. So in these cases, we will get after the ejection what? The ejection of the blood. That means ejection click we can say. So if I just consider it in this way, first we are getting what? First we are getting the S1. Okay, this is the S1. After that we are getting what? The ejection click. That means the blood that is going from the ventricles to the aorta in terms of the left ventricle, and the blood is going from the right ventricles to the what? Pulmonary, that means to the lungs. Okay. After that we will see the pressure that will fall down where within the ventricles. As a result, we will see there will be closure of the both ventricles, the closure of this two valve. That means in terms of the what over here, the aortic valve along with also what? That is the pulmonary valve. Now in these cases we will see over here. Let me erase this part. Now in this time, whatever the thing we'll see over here. Okay, just like this. In this case, see the both the mitral valve also and what we'll see over. In this time, whatever the thing we'll see over here. See, in these cases we'll get the aortic valve and the pulmonary valve. There will be opening. So whenever the opening is over here, we are getting the ejection click. Okay, and the next page we are getting what? The pressure within the both ventricles that will keep on decreasing. As a result, we will see there will be what? Closure of the ventricles over here. That means closure of both. I mean A2, and in terms of this one, I can consider the P2. We'll say we will get the closure of this. So after that, we are getting the what? The heart sound that is known as S2. Here we will get what? Here we will get the S2. So after the ejection click, let me show over here. We will get the ejection click over here. After that, we will get over here the what? S2. Okay. Now see, from S1 to S2, all these things we are getting in terms of the what? Systole. All these things we are getting in terms of systole. Now, after that, what type of thing we will see? After this one, we will see the blood. What? Both of the atrium, they will keep on accumulating blood. Okay, accumulating blood. Now after H2, whatever the thing we will get over here, see, whenever the blood that will come over here, whenever the blood that will come over in these regions, okay, see, the blood will keep on accumulating in the both atriums. Okay, both atriums. Now we'll see there will be, whenever the pressure within the atrium that will be greater than the ventricular pressure, we'll see whatever the thing we'll see, there will be closure of the both valves. This one and this one. Now whenever we are getting the opening of the both, I mean in terms of the mitral and tricuspid valve over here, in these pages we will get the opening snap. These portions, we can write it over in this way. This is known as opening snap. Opening snap. Okay, and after that we will see whenever the blood that will come where within the ventricles, from the atrium within the ventricles. In these cases, let me show you the different color. Just try to understand from here. In these cases, whatever thing we will get over here, see, we will get the S3. We will get the S3. Whenever we will see the rapid ventricular pressure, whenever we will see that the rapid filling, whenever we will see within the ventricle, the rapid ventricular filling, at this time we can see what? The S3. So in these cases, we can get the S3 over here. After that, we will get S4, and after that again we will get S1. Just like this. So this was all about the different types of the heart sounds. So let me show the better diagram for you. Let me erase this part. So first, let me erase this part. Then I will start things over here. Now first we will get over here whatever thing. First we will get this one. Okay. Then we will get the ejection click. Ejection click. After that whatever thing we will get over here. After the ejection click we will get the S2. Okay. After S2 we will get what? Opening snap. Okay. Now see, whenever the opening snap we will get in terms of, normally we get the opening snap normally, okay, in the daily routine base. Now if we get the opening snap, if it is louder, then whenever the opening snap, let me show it over here. Whenever the opening snap, that means, okay, just like this. it will be louder. That can detect the what? Mitral stenosis. Mitral stenosis. Okay. Now, after opening snap, we got it over here already. Then we'll get what? These three. Then we'll get what? S4. Then we'll get again S1, just like this. Okay. Now see, from here we need to know that S3, where can we get a rapid ventricular filling? Ventricular filling in this case. Okay. That's why another name for it, ventricular gallop or rhythm. Okay, or rhythm. And what about this one? In terms of the S4, we will get, it is known as atrial gallop or rhythm. We'll talk about these things in the separate videos. Okay, in terms of the S3 and S4. Now we'll talk about different types of the effects in terms of the fast heart sound. Okay, so first we'll talk about the different kinds of the tumors. In terms of the cardiac tumors, we'll say now, for example, just like this. So let me define it, this part. Now is the right atrium or right ventricle, is the left atrium and left ventricle. Okay, the left ventricle. Now see, we can get the different types of tumors, but most common, the benign tumor we can get over here. So the most common benign tumor, okay, is like the metastatic tumor. Metastatic tumor, that means by the metastasis process from the lungs or from the breast, the different types of the what cancer cells can come over here and they can cause what? The cardiac tumors. Now one of the cardiac tumors we can get over here, for example, just like this one. Okay. Now see, whenever we are getting this type of the tumor in the what? Left ventricle, sorry, in the left atrium, so we are getting the tumor left atrium. Now we are getting the tumor in the left atrium. Now see, what type of the problem we'll see over here whenever you are getting this type of tumor. Okay. So they will what? Inhibit the blood flow from the left atrium to the left ventricle. In these cases, we will see inhibitions of blood flow towards left ventricle. And see, as if you consider the right side, in this case it's the normal, so there will be no problem. The blood will come normal. Okay, there will be no problem. There are no compromises in terms of the blood flow. But in terms of the left side and this type of the tumors, what we are talking right now, these are the free floating. Okay, these tumors free floating within the left atrium. Okay. Now we have to know that, see, whenever the tumors we are getting in these cases, they are what? They are doing the obstructions in the blood flow. So whatever the blood that is going, okay, so the input blood within the ventricle, that will be less. As a result, from the ventricle, the output blood, that will be also less. This type that can cause ischemia. Okay. Now the problem is over here, as far as the heart sound is concerned. Now there is a chance these tumors, okay, when the valve is already open, these tumors can come over here and it can hit the valve leaflets. So whenever these tumors that will come where within the already open valve and it will hit. So let me write it over here that tumor hits the valve leaflets at the time we'll hear one kind of the characteristic sound that is known as tumor plop sound. We'll get the tumor plop sound. We get tumor plop sound, and this type of the plops or tumor sounds we get tumor plop over here. Okay, this is the low pitch. We can get it over the low pitch. Low pitch. Okay. So whatever the sounds we'll get over the low pitch sounds. So in terms of the cardiology, we'll get over here. For example, let me write the names. So low pitch heart sound we'll get in terms of S3, we'll get in terms of the S4, and we'll get in terms of tumor plop sound. Tumor plop sound. That means these sounds they can be heard by the bell part of the diaphragm. Okay, this stethoscope. Okay, bell part of stethoscope. Sorry, that means these sounds, low pitch heart sound, I mean in terms of the S3, S4 and tumor plop sound, they can be heard well by using the bell part of the stethoscope. Okay, that means the small one. Now we'll talk about whatever the clinical manifestations we'll get in these cases. Okay. Now see, if we see the increasing of the size of the tumor, for example, from here we are getting this type of the tumor, increasing size. So whenever the size will be increased, there will be the different types of the clinical manifestation in terms of there will be obstruction in the blood flow. That means the blood, whatever it will come over here, that will be turbulent. It will be turbulent over here. Okay, we will get the turbulent blood flow. So let me read this from here. Yes. Now see, whenever we are seeing the obstructions over here, whenever we are seeing for the for the tumor, we are getting the obstructions. It is causing the obstructions. So as a result, there is a chances for the blood to go from the left atrium to the lungs. So that can cause the pulmonary edema. That can cause pulmonary edema. When you will get the pulmonary edema, there will get the dyspnea. That means shortness of breath. You get the shortness of breath, this type of thing. Okay. Now see, whenever, for example, an individual who has come to our OPD and he is just complaining about this type of the symptoms, for example, he is just saying first, for example, that we are talking in terms of the woman individual. Okay, she has come to our OPD and she is complaining that she is not able to go up to the 20 steps. Okay, before she was able to go up to 20 steps, but right now she is not able to go. Now we can just consider in these cases what type of the thing we'll see, the effort intolerance. Okay, in these cases we can get the effort intolerance. First we'll get the effort intolerance, and the second times we can get it over here that we'll get the dyspnea. Now see, try to understand from here. Whenever the individual, whenever the size of the tumor is getting increased, just try to understand from here that whenever the individual is sitting under the sitting conditions due to the gravity, whenever the individual is under the sitting conditions due to the gravity, the tumor that will come where within the valvular plates. So whenever it will come within the valvular plates, the symptoms will appear more clearly. Now see, so let me write it over here. During the sitting condition, at the time the symptoms that will appear clearly. Okay, whenever the individual is under the supine positions, so let me write it over here. During supine position, at the time there will be no problem in terms of the gravity. Okay, because the tumors from here, it can go to the different parts, other parts it will not here because the gravity is not working just like the before. Okay, so in these cases we will get that the symptoms that will be less over here. Different types of the problems. Okay, so the dyspnea will get, so during the sitting conditions we will get the dyspnea, the symptoms in terms of the dyspnea that will be more. In terms of the supine conditions, because the tumor right now that will be what from the valvular plates, it will go to the different regions. As a result we will see the obstruction that will be less. As a result we will see the symptoms of dyspnea that will be less over here. Okay, now we'll talk about in terms of the investigations. Now let me talk about in terms of the investigations. What type of the investigations you can do in these cases? Now let me show you the investigations of the choice for these things. You have to do the echo. Have to do the echo. Now we can do the echo two types over here. As far as the ventricle is concerned, as the diagram is in terms of the two-dimensional figure over here. So you can do over here in terms of the ventricle and in terms of the atrium over here. In terms of the atrium, we have to do the transesophageal echo. Okay. Now, in terms of the ventricles, we have to do what? Transthoracic. We have to do the echo in terms of the transthoracic. Okay, this type of the problem. Now, whenever after doing the echo, whenever we'll come to know, we'll get confirmed that yes, the tumor is present over here. Instant, we have to send the patients where in terms of cardiothoracic. Okay, let me write it over here in full terms. Okay, let me use this one. Cardiothoracic vascular surgeon. Vascular surgery. That means once we are getting the confirmations that yes, the individual is having this type of the tumor, and let me tell you the most common type of the benign tumor over here, that is known as atrial myxoma. So the type of the tumor over here, that will be known as atrial myxoma. So whenever we are getting the confirmations that yes, the individual is having the atrial myxoma, instant we have to send the patient in terms of the cardiothoracic vascular surgery. And if we just send the, if you can send the patient on time, then it will be successful. Okay, let me write it over. So it will be on the better. It will be the one. It will be on. You can see in terms of the best prognosis. Okay, when you are just coming to the individual having the atrial myxoma, and instantly you have to send the patient in terms of the cardiothoracic vascular surgery. And whenever the surgery will be done, after that the patients will be come back to in the normal form. Okay, in these cases. Now we'll talk about the different aspects in terms of the pericarditis. Before that, let me tell you the one type also the tumor. Let me use over here this one. Now if we get, for example, the tumor over here, just like this, and if we get just like this. Now, for example, the tumor was here in terms of the left atrium, the tumor was freely movable. Now, for example, if we get any kind of the tumors, for example, over here within the valve plates. So, whenever we will get the tumors within the valve plates, this type of the tumor known as what? Papillary elastoma. So, this type of the tumor that is known as papillary elastoma. So whenever we get this type of the tumors, try to understand whenever the tumors will be on the valve plates. Okay, at that time it will cause the what? The damage of the valve plates. So in these cases we have to do the what? Replacement by what? The prosthetic valve. We have to do the treatment in terms of by replacing what? This one. We have to replace by what? The prosthetic valve. That is the treatment of choice in these cases. Because we cannot do anything in terms of these things, because the valve already got damaged over here. Whenever we are getting the tumors in terms of the where on the valve leaflets, at the time the valve it will be already damaged. We have nothing to do over here. So we have to do what can we do over here? We can just replace this one by prosthetic valve. That's the treatment of choice in this case. Now what is the most common type of let me tell you. This over here. I'm erasing this part, guys. Okay. So if I say right now that in terms of the tumor, the most common primary malignant cardiac tumor, that will be what? angiosarcoma. Angiosarcoma. This will be the most common primary malignant tumor. Okay. Now we'll talk about the different types of the infections that can cause also. For example, if we just talk in terms of the pericarditis. Now see, whenever we are getting the pericarditis or pericardial effusion, as a result, we'll see the pericardium that will squeeze the heart. As a result, the volume of the heart that will be decreased. So as a result, we can also see the obstruction in the valve levels. So for it, we can also see the abnormal sounds in terms of the fast heart sound. Okay. Now we'll talk about those things. First, we'll talk about the first pericardial. Let me write it about the whole things first. Now we'll get the different types of the things over here in terms of the pericarditis. Let me write it over in terms of the tubercular pericarditis. Now whenever we are getting the tubercular pericarditis, whatever the thing we'll get over here, see, we'll get the different types of the symptoms over here. One of the most important symptoms is the night sweating. We get the night sweating. We can get also over here the weight loss. Around 5% as far as Harrison is concerned. Within 6 months, we can say is the involuntary weight loss. We'll get the involuntary weight loss around 5% within 6 months. Okay. In Harrison's, it will be written just like this 10 lbs. It's not 10% in terms of the pounds. In terms of is the pound pump. Okay. Now, then whatever the thing we'll get over here, we'll get the chest pain. We'll get the chest pain at resting condition. We'll get the chest pain at the resting conditions because of what the phrenic nerve is involved over here. Okay, so we'll get the night sweating, we'll get the weight loss over here, we'll get the chest pain at resting conditions also. Now, one kind of the also important thing over here that as it infections over here, pericarditis, so we can get also the low grade fever. Low grade fever. The other investigations, whatever the thing you can do over here, or findings for these things. Okay. Now in these cases we will get the pericardial or rub frictions. It's important thing. A pericardial or rub friction. Now that means what? This type of thing, that means whenever the breath, for example, if you just hold the breath or breathing, at that time also we can hear the sound. But if you just compare with the plural frictions over here, plural rub frictions, rub friction, in these cases we can only see, we can also only can feel or you can hear in terms of what inspiration we'll get. So by just doing like this, we can differentiate in between the pericardial rub friction and the plural friction rub frictions. Okay, in terms of the pericardial rub frictions, we'll get what during the breathing conditions, whenever we'll say the individual to hold the breath for a few seconds, and after holding the breath, we'll see still we can hear the sounds. But whenever we'll just talk the patients in terms of the plural rub frictions, whenever we'll tell the patients just hold your breath, that will not see any, we cannot hear any type of the sounds. Okay, just like this we can differentiate in between the pericardial rub frictions and the plural rub frictions. Okay, now as far as the ECG is concerned over here, whatever the thing we'll get in these cases. Now from the findings of the ECG, whatever the thing we'll get over here in terms of the ECG, we'll get the ST segment elevation. Now whatever the elevations we'll get over here, because I can say also in terms of the myocardial infections we will also get the ST segment elevation,